Magnesium. It's been called the miracle mineral. Millions of seniors across America are popping magnesium supplements every single day, believing it's helping their health. And for many of them, it absolutely is. But here's what almost nobody is talking about. For some people, especially those over 60, taking magnesium could actually be dangerous. I'm not trying to scare you. I'm trying to protect you. Because today, I'm going to reveal 4 critical warning signs that mean you should never take magnesium, and 5 unmistakable signs that your body is practically begging you to start taking it every single day. One of these signs is so commonly ignored by seniors that doctors say it leads to thousands of unnecessary emergency room visits every year. So please, stay with me for the next few minutes. This information could genuinely change your life. Welcome back to the channel. If you're new here, we focus on delivering clear, practical health information specifically for adults over 60 and the families who love them. And today's topic is one of the most important ones we've ever covered. Let's talk about magnesium. Now, magnesium is a mineral. It's found naturally in foods like spinach, almonds, bananas, and dark chocolate. Your body needs it for over 300 different chemical processes. 300. That's not a typo. Your muscles need it to move. Your nerves need it to send signals. Your heart needs it to beat in a steady, reliable rhythm. Even your bones depend on magnesium to stay strong. So why does this matter so much if you're over 60? Well, here's the uncomfortable truth. As we age, our bodies become significantly less efficient at absorbing magnesium from the food we eat. Studies published in the Journal of the American Geriatric Society have found that nearly half of all Americans over the age of 60 don't get enough magnesium through their diet alone. Half. That's an enormous number. On top of that, many common medications that seniors take, things like blood pressure pills, water pills, and acid reflux drugs, can actually drain magnesium from your body even faster. So you've got a situation where your body needs this mineral desperately, it's absorbing less of it, and your medications might be flushing it out. It's no wonder so many seniors are dealing with problems that are directly linked to low magnesium without even realizing it. But, and this is the critical part, magnesium isn't right for everyone. For certain people with certain health conditions, taking a magnesium supplement could cause real harm. And that's exactly why you need to hear both sides of this story today. We're going to start with the 5 signs that your body is telling you it needs magnesium. Then, I'll share the 4 warning signs that mean you should absolutely avoid it. Please watch this entire video, because understanding both sides could make all the difference in the world for your health. Let's get into it. Sign number 1. You're getting muscle cramps, especially at night. Let me paint a picture for you. It's 2 in the morning. You're finally sleeping peacefully after a long day. And then, out of nowhere, a sharp, agonizing cramp grabs your calf muscle and twists it like a wrung-out towel. You jolt awake, gasping, reaching down to grab your leg, trying to stretch it out. The pain is intense. It might last 30 seconds. It might last 2 or 3 minutes. And by the time it's over, you're wide awake, your heart is pounding, and there's no going back to sleep. Sound familiar? If you're nodding your head right now, you're not alone. Nighttime leg cramps are one of the most common complaints among adults over 60. And while there can be several causes, one of the most frequent and most overlooked causes is low magnesium. Here's why. Magnesium plays a direct role in muscle relaxation. When your muscles contract, calcium helps them tighten up. Magnesium is the mineral that tells them to let go and relax. When you don't have enough magnesium, your muscles can get stuck in a contracted state. That's a cramp. And it's not just your legs. Some people notice twitching in their eyelids. Others get cramps in their feet, their hands, or even their back. If you're experiencing frequent muscle cramps or spasms, particularly at night, your body might be sending you a very clear message. It needs more magnesium. Many seniors simply accept these cramps as a normal part of aging. They think, well, I'm getting older. This is just how it is. But that's not always true. Sometimes, the solution is as simple as giving your body the mineral it's been missing. Sign number 2. You can't sleep well, no matter what you try. Now, I just mentioned those nighttime cramps waking you up. But even without the cramps, poor sleep is another major sign of magnesium deficiency. Let me ask you something. Do you lie in bed at night, staring at the ceiling, feeling tired but completely unable to fall asleep? Or maybe you fall asleep just fine, but you wake up at 3 or 4 in the morning and can't get back to sleep no matter what you do. And when morning finally comes, you feel like you barely rested at all. If this sounds like your nightly routine, low magnesium could be playing a much bigger role than you realize. Magnesium helps regulate something called GABA. Now, don't worry about remembering that name. Just think of GABA as your brain's natural calm down signal. It's the chemical that tells your nervous system to relax, to slow down, to prepare for sleep. When magnesium levels are low, your brain has trouble producing enough of this calming signal. The result? Your mind races, your body stays tense, and restful sleep becomes almost impossible. Research published in the Journal of Research in Medical Sciences found that magnesium supplementation in elderly adults significantly improved sleep quality, helped them fall asleep faster, and allowed them to sleep longer through the night. So before you reach for another sleeping pill, which can come with its own serious risks for seniors, it might be worth considering whether your body simply needs more magnesium. Talk to your doctor about it. It could be a game changer. Sign number 3. You feel exhausted and fatigued all the time, even after resting. This is one of those signs that many seniors ignore because they chalk it up to age. I'm just getting old, they say. Of course I'm tired. But here's what I want you to understand. There's a difference between the natural, gentle slowing down that comes with aging and the kind of deep, persistent fatigue that makes you feel like your battery is permanently stuck at 10%. If you wake up tired, if you feel drained by the middle of the afternoon, if even simple tasks like making lunch or walking to the mailbox leave you feeling wiped out, something more might be going on. Magnesium is absolutely essential for energy production in your body. Every single cell in your body uses something called ATP, which is basically the fuel your cells run on. Think of ATP as the gasoline in your car. Well, magnesium is required to create that fuel. Without enough magnesium, your cells simply can't produce energy efficiently. It's like trying to run your car with a clogged fuel line. The engine sputters, it struggles, and eventually it just doesn't perform the way it should. So that bone-deep tiredness you've been feeling? It might not be about your age at all. It might be about a mineral deficiency that your body has been trying to tell you about for months or even years. Sign number 4. You're experiencing feelings of anxiety, nervousness, or low mood. Now, this one surprises a lot of people, so let me explain. We tend to think of anxiety and mood problems as purely emotional issues. Something's bothering you, you're worried about your health, you're stressed about money or family. And yes, those things can certainly affect how you feel emotionally. But there's also a very real, very physical component that many people don't know about, and magnesium is right at the center of it. Remember that calming brain chemical I mentioned earlier, GABA? When magnesium is low, your nervous system doesn't get that calm down signal as effectively. The result can be a persistent feeling of unease. You feel on edge. Your heart might race for no clear reason. You might feel irritable or snappy with loved ones and not understand why. Some people describe it as a feeling of dread that sits in their chest, even when nothing is actually wrong. Studies have shown that adults with low magnesium levels are significantly more likely to experience symptoms of anxiety and depression. And here's the encouraging part. Some of those same studies found that when magnesium levels were brought back to normal through supplementation, many of those emotional symptoms improved noticeably. I want to be very clear here. I'm not saying magnesium is a replacement for professional mental health care. If you're struggling emotionally, please talk to your doctor. But if you've been feeling anxious or low and nobody can quite figure out why, low magnesium is absolutely worth investigating. Sign number 5. You're noticing an irregular heartbeat or heart palpitations. Now, I saved this one for last because it's arguably the most important and the most serious. Has your heart ever done that strange little flutter? That feeling where it skips a beat or suddenly pounds hard for a moment and then goes back to normal? It's unsettling. It's scary. And if you're over 60, it's something you absolutely should not ignore. Magnesium is critical for maintaining a steady, regular heart rhythm. It works alongside other minerals like potassium and calcium to keep your heart's electrical system functioning properly. When magnesium drops too low, that electrical system can misfire. The result can be palpitations, skipped beats, or a fluttering sensation in your chest. In more serious cases, severe magnesium deficiency has been linked to dangerous heart rhythm disorders, including a condition called atrial fibrillation. That's when your heart beats in a rapid, irregular pattern, and it significantly increases the risk of stroke. Now, heart palpitations can have many causes, and you should always get them checked out by your doctor. But study after study has confirmed that low magnesium is one of the most common and most correctable causes of irregular heartbeat in older adults. If your heart has been doing things that don't feel right, please mention magnesium to your doctor at your next visit. It's a simple blood test, and the answer could bring you enormous peace of mind. Now, before we move on to the 4 warning signs, I want to pause for just a moment. If you're over 60 or if you're caring for an elderly loved one, this information could genuinely be life-saving. I don't say that lightly. Understanding when to take magnesium and when to avoid it is the kind of knowledge that can prevent serious health complications. So if you're finding this helpful, I'd really appreciate it if you'd hit that subscribe button and tap the bell so you never miss a video like this. And if someone you love could benefit from hearing this, please share this video with them. It could make a real difference. Alright, now let's get into the part of this video that not enough people are talking about. Warning sign number 1. You have kidney disease or impaired kidney function. This is the single most important warning on this entire list, and I need you to take it very seriously. Your kidneys are your body's filtration system. Everything that goes into your body, including minerals like magnesium, eventually passes through your kidneys. Healthy kidneys are very good at managing magnesium levels. If you take in a little too much, your kidneys simply flush the excess out through your urine. No problem. But if your kidneys aren't working properly, and this is more common in seniors than many people realize, they may not be able to flush out that extra magnesium efficiently. Instead, it starts to build up in your blood. And when magnesium levels in the blood get too high, a condition called hypermagnesemia, the consequences can be severe. We're talking about dangerously low blood pressure, difficulty breathing, extreme muscle weakness. In the most serious cases, it can cause your heart to slow down dramatically or even stop. I don't tell you this to frighten you. I tell you this because so many people assume that because magnesium is natural, it must be safe for everyone. That's simply not true. If you have been diagnosed with chronic kidney disease, if your doctor has ever told you that your kidney function is reduced, or if you're on dialysis, you should not take magnesium supplements without explicit approval and monitoring from your doctor. Period. And here's something many seniors don't know. You can have significantly reduced kidney function without any obvious symptoms. It's often called a silent condition. This is why regular blood work, including kidney function tests, is so important as you get older. Don't guess. Get tested. Warning sign number 2. You're taking certain medications that interact with magnesium. This is a big one, and it catches a lot of people off guard. Magnesium can interact with a surprisingly long list of common medications. And when I say interact, I mean it can either make your medication less effective, or it can amplify the effects to dangerous levels. Let me give you some specific examples. If you take heart medications, particularly a drug called digoxin, which is used to treat heart failure and certain irregular heart rhythms, magnesium can interfere with how your body processes that medication. The interaction can lead to serious heart complications. If you take certain antibiotics, specifically a class called tetracyclines or another class called quinolones, magnesium can bind to these drugs in your digestive system and prevent your body from absorbing them properly. This means the antibiotic might not work when you need it most, like when you're fighting a serious infection. If you take blood pressure medications, adding magnesium on top of those drugs can cause your blood pressure to drop too low. This can lead to dizziness, fainting, and dangerous falls, which is one of the leading causes of serious injury in seniors. If you take diuretics, sometimes called water pills, the interaction becomes even more complex because some diuretics cause you to lose magnesium, while others cause you to retain it. Taking a supplement on top of a magnesium-sparing diuretic could push your levels too high. And if you're taking bisphosphonates for osteoporosis, drugs like alendronate, magnesium can reduce how well your body absorbs that medication, making it less effective at protecting your bones. Here's the bottom line. If you take any prescription medications, and most seniors take several, you must talk to your doctor or pharmacist before adding magnesium to your routine. Bring them a list of everything you're taking, including over-the-counter supplements. Let them check for interactions. It's a simple conversation that could prevent a serious problem. Warning sign number 3. You have a very slow heart rate or a condition called heart block. Now, earlier in this video, I talked about how magnesium can help regulate your heart rhythm, and that's absolutely true. But there's a flip side to this coin that's very important to understand. Magnesium has a natural relaxing effect on your heart. It helps slow down electrical impulses and keeps things calm and steady. For most people, this is a good thing. But if your heart rate is already abnormally slow, a condition doctors call bradycardia, adding magnesium to the mix could slow it down even further, and that can be dangerous. There's also a condition called heart block, which is different from a blocked artery. Heart block means the electrical signals that tell your heart when to beat are being delayed or partially interrupted. Your heart still beats, but the timing is off. It's more common in older adults, and many people who have mild forms of it don't even know. If you have either of these conditions, taking supplemental magnesium could worsen the problem. It could cause your heart to beat too slowly to effectively pump blood to your brain and vital organs. The symptoms can include severe dizziness, confusion, fainting, and in extreme cases, cardiac arrest. This is why I keep emphasizing the importance of talking to your doctor. If you've ever been told you have a slow heartbeat, or if you've had an EKG that showed any type of heart block, please discuss magnesium with your cardiologist before taking it. Warning sign number 4. You're experiencing digestive symptoms like chronic diarrhea, nausea, or abdominal cramping. Now, this warning sign works in 2 important ways, so let me explain both. First, if you're already dealing with ongoing digestive issues, particularly chronic diarrhea from conditions like irritable bowel syndrome, inflammatory bowel disease, or any other gastrointestinal disorder, certain forms of magnesium can make these problems significantly worse. Magnesium citrate and magnesium oxide, 2 of the most commonly sold forms, are known to have a strong laxative effect. In fact, magnesium citrate is literally used as a bowel prep before colonoscopies. So if your digestive system is already sensitive or overactive, these forms of magnesium can cause severe diarrhea, dehydration, and dangerous electrolyte imbalances. Second, and this is equally important, if you've recently started taking magnesium and you're now experiencing persistent nausea, stomach cramps, or diarrhea, your body may be telling you that you're taking too much or that the form you're using isn't right for you. Some people take this as a sign that they need to push through it. My body just needs to adjust, they tell themselves. But that's not always true. Ongoing digestive distress from magnesium is not normal and should not be ignored. It can lead to dehydration, which is especially dangerous for seniors. It can cause you to lose other critical electrolytes like potassium and sodium. And in some cases, it could be masking a more serious underlying problem. If magnesium is upsetting your stomach, stop taking it and talk to your doctor. They may recommend a gentler form, like magnesium glycinate, which is much easier on the digestive system. Or they may determine that magnesium isn't appropriate for you right now. So, what should you do with all of this information? Let me give you some practical, actionable steps you can take starting today. Number 1. Don't self-diagnose. If you recognized yourself in any of the 5 signs that suggest you need magnesium, that's valuable information. But please don't just run out and buy a supplement without talking to your doctor first. A simple blood test called a serum magnesium test can help determine where your levels stand. Keep in mind, though, that this test isn't perfect because most of your body's magnesium is stored inside your cells and bones, not in your blood. So even a normal blood result doesn't always tell the whole story. Your doctor can also evaluate your symptoms, your medications, and your kidney function to give you a complete picture. Number 2, focus on food first. Before reaching for a supplement, try to increase the magnesium-rich foods in your diet. Dark leafy greens like spinach and kale are excellent sources. So are nuts, particularly almonds and cashews. Pumpkin seeds are one of the richest magnesium sources on the planet. Whole grains, black beans, avocados, and yes, Even dark chocolate with at least 70% cocoa all contain meaningful amounts of magnesium. Getting your minerals from food is almost always safer and better absorbed than getting them from a pill. Number 3. If you do supplement, choose the right form. Not all magnesium supplements are created equal. Magnesium glycinate is generally the gentlest on the stomach and is well absorbed. It's often recommended for sleep and relaxation. Magnesium citrate is well absorbed but has a laxative effect, so it's better for people dealing with constipation. Magnesium oxide is cheap and widely available but is poorly absorbed, and most of it passes right through you. Magnesium threonate is a newer form that some research suggests may support brain health, though more studies are needed. Talk to your doctor about which form and which dosage is right for your specific situation. Number 4. Start low and go slow. If your doctor gives you the green light to take magnesium, don't start with a high dose. Begin with a low amount and gradually increase it. This gives your body time to adjust and reduces the risk of digestive side effects. Number 5. Keep a symptom journal. Write down how you feel before starting magnesium, and then track any changes over the following weeks. Better sleep? Fewer cramps? More energy? Or are you experiencing side effects like loose stools or nausea? This information is incredibly valuable for you and your doctor. Let's bring this all together with a quick recap. Your body needs magnesium. That is not up for debate. It's essential for your muscles, your nerves, your heart, your sleep, your energy, and even your mood. And as you get older, the risk of running low on this critical mineral goes up significantly. The 5 signs that you may need more magnesium are persistent muscle cramps and spasms, especially at night, chronic difficulty sleeping, unexplained fatigue that rest doesn't fix, feelings of anxiety, nervousness, or low mood that seem to come from nowhere, and heart palpitations or an irregular heartbeat. But magnesium is not safe for everyone, and that's the message I really need you to take away today. The 4 warning signs that you should never take magnesium without medical supervision are having kidney disease or reduced kidney function, taking medications that interact with magnesium, including heart drugs, certain antibiotics, blood pressure pills, and osteoporosis medications, having a very slow heart rate or a condition called heart block, and experiencing significant digestive symptoms like chronic diarrhea, nausea, or stomach cramping. Knowledge is power, my friend. And the fact that you watched this entire video tells me that you care about your health, that you're the kind of person who wants to make informed decisions, not just follow trends. And I deeply respect that. Too many people think of supplements as harmless because they're sold over the counter. But as we've learned today, even something as seemingly simple as magnesium can help you tremendously or harm you seriously, depending on your individual health situation. So please take what you've learned today and use it. Have a conversation with your doctor. Get your levels checked. Look at your diet. And make a decision that's right for you, your body, and your unique health picture. You deserve to feel your best at every age. Not just surviving, but truly thriving. And sometimes that starts with something as small as understanding one little mineral. If this video helped you, I would be so grateful if you'd hit that like button and subscribe to this channel. We put out new videos every week focused on keeping you healthy, informed, and empowered as you age. And please, if you have a friend, a spouse, a parent, or a neighbor who takes magnesium or who's been thinking about starting it, share this video with them. You never know, it might be exactly what they need to hear today. I'd also love to hear from you in the comments. Do you take magnesium? Have you noticed any of these signs? Drop a comment below and let's start a conversation. I read every single one. Thank you so much for watching. Take care of yourself. You matter more than you know, and I'll see you in the next video.